Hey there, whether you are in your 20s, 30s, or beyond, vaccinations are not just for kids. They play a crucial part in keeping you healthy and thriving at every stage of life. I am Dr. Arun Kumar. Welcome to our video on the vital role of vaccinations for adults. Today, we are going to explore why getting vaccinated as an adult is so important and how it can protect you and your loved ones from serious diseases. So first one we will talk about the influenza or flu vaccine. The flu vaccine is recommended for individuals aged 6 months or older, especially those who are at high risk of complications such as elderly, pregnant women, young children and individuals with chronic health conditions, example asthma, diabetes or heart disease. Healthcare workers or caregivers to prevent the spread of the virus to vulnerable population. The vaccine is typically administered via intramuscularly, commonly in the deltoid muscle for adults and older children, or the anterolateral thigh for infants. It is also available as intranasal for the live attenuated influenza vaccine LAIV. It is suitable for certain age groups. In the children from 6 months to 8 years, they may require two doses spaced at least 4 weeks apart if receiving the vaccine for the first time. In adults and older children, a single annual dose is sufficient. The vaccine is updated yearly to match circulating strains, so annual vaccination is necessary. While vaccinating, while vaccinating with influenza vaccine, inform the healthcare provider about any history of severe allergic reactions, especially to vaccine components like egg protein. Though egg-free options are available, delay vaccination if experiencing moderate to severe illness with fever. Monitor for mild side effects like soreness at the injection site, low-grade fever, or fatigue, which usually resolve quickly. The vaccine is contraindicated in severe allergic reactions like anaphylaxis to previous dose of the flu vaccine or its component. For the live attenuated vaccine, avoid in pregnant women, immunocompromised individuals, and those with certain chronic conditions. Let's move on to the second vaccine, that is tetanus, diphtheria, and pertussis (Tdap) vaccine. It is indicated or recommended for adolescents, a single dose given at age 11 to 12 years. In pregnant women, one dose during each pregnancy, preferably between 27 to 36 weeks of gestation to protect newborn from pertussis. In adults, a single dose if they have not previously received Tdap, following by a TD, that is tetanus and diphtheria booster every 10 years. In cases of post-exposure prophylaxis, uh, where the wounds are severe or contaminated if last tetanus vaccine was more than 5 years ago. The vaccine is administered intramuscularly, typically in the deltoid muscle of the upper arm. A single dose of Tdap is sufficient for most individuals. Pregnant women should receive one dose during each pregnancy. Adults should follow up the tetanus diphtheria boosters every 10 years. In case of any history of severe allergic reaction to vaccine components, inform the healthcare provider. Mild side effects like redness, swelling, or pain in the injection site, as well as fever or fatigue may occur. Individuals with moderate or severe illness should delay vaccination until the recovery. It is contraindicated in the severe allergic reaction to previous dose, or there is history of encephalopathy like coma or prolonged seizure, while in a 7 days of a previous pertussis containing vaccine not attributable to another cause. Third vaccine is human papilloma vaccine, that is HPV, human papilloma virus vaccine. It is recommended for adolescent and young adults, ideally administered before exposure to human papilloma virus, typically at ages 11 to 12, but can be given as early as 9 years. Catch-up vaccination recommended for individuals up to 26 years who missed the earlier doses. In special cases, some adults aged 27 to 45 years may be benefited from the vaccination based on individual risk factors as determined by a healthcare provider. It is administered intramuscularly, usually in the deltoid muscle of the upper arm or the anterolateral thigh. While talking about the doses and schedule, during age 9 to 14 years, two doses spaced between 6 to 12 months apart are given. From age 15 to 26 or in immunocompromised individuals, three doses given at 0, 1 and 2 months and 1 to 2 months and third dose is at 6 months. The vaccine protect against the high-risk human papillomavirus types that cause cervical, anal or other cancers as well as genital warts. Inform the healthcare provider about any history of severe allergic reactions, especially to vaccine components like yeast. Mild side effects such as pain at injection site, fever, dizziness may occur. Individuals should remain seated or lying down for 15 minutes after vaccination to prevent the fainting. If you have severe allergic reaction to a previous dose of HPV vaccine or its component, then avoid the vaccination. In case of pregnancy, vaccination should be delayed until after the pregnancy, although no harm has been shown if inadvertently given. Fourth vaccine is pneumococcal vaccine. Pneumococcal vaccines are recommended for children under 5 years to prevent invasive pneumococcal disease like pneumonia, meningitis, and sepsis. In adults aged 50 years or older, routine vaccination is advised. In the individual who are at increased risk, those with chronic illness like diabetes, heart disease, weakened immune system, or conditions like cochlear implants or cerebrospinal fluid leaks, it is indicated. Pneumococcal vaccines are administered through intramuscularly IM, typically in the deltoid muscles for adults, and in older children, the anterolateral thigh for infant. Doses and schedule of this vaccine in the children, a 4-dose series that is at 2, 4, 6 and 12 to 15 months is recommended. In adults, PCV 15 or PCV 20 is given as a single dose. If PCV 15 is used, an additional dose of PPSV 23 may be required after 1 year. In the case of catch-up vaccination, it is available for those who missed the earlier doses. Inform the healthcare provider if you have any severe allergic reaction to the previous or any vaccine component. Mild side effect like redness, swelling and fever may occur. Vaccination should be postponed in cases of severe acute illness. It is contraindicated in the conditions when you have severe allergic reaction to previous dose and having minor illnesses like cold. The minor illnesses like cold are not the contraindication, but severe illness may require delay in vaccination. Fifth is the shingles, that is herpes zoster vaccine. Herpes zoster vaccine is recommended for the adults aged 50 years or older. It is given to prevent the shingles and its complications such as post-therapeutic neuralgia. In immunocompromised individuals and aged 19 years and older, based on healthcare provider recommendation, it can be given. It is administered intramuscularly, typically in the deltoid muscle. Recombinant zoster vaccine, that is RZV, 2 doses are given 2 to 6 months apart. The vaccine provides long-lasting protection against shingles and its complication. In case of having any allergic reaction to vaccine component, inform the healthcare provider. Mild side effect like redness, swelling, pain, fatigue, headache, etc. may occur as a side effect. Individuals with moderate or severe illness should delay vaccination until recovery. It is contraindicated in the severe allergic reaction to previous dose. It is contraindicated in pregnancy. Vaccination should be delayed until after the pregnancy. Next vaccine is Hepatitis B vaccine. It is indicated or recommended for infants. It is administered at birth in infants to prevent chronic hepatitis B infection. unvaccinated children and adolescents under 19 years, adults aged 19 to 59 years, especially those at risk due to occupational exposure, chronic liver disease, or lifestyle factors. Adults aged 60 years or older based on individual risk factor or desire for protection. It is administered intramuscularly, typically in the deltoid muscle for adults and older children, or the anterolateral thigh for infants. In infants, a 3-dose series at birth, 1 to 2 months, and second is 6 to 18 months. In children and adults, a 3-dose series that is at 0, 1 and 6 months is given. Alternative schedules are also there, like a 2-dose series that is Hepatitis B for adults given 1 month apart. It can cause mild side effects like soreness at the injection site, fever or fatigue. Vaccination should be delayed in case of moderate or severe acute illnesses. Contraindicated in severe allergic reaction to previous dose or vaccine or its component. In case of minor illness like cold, it is not contraindicated, but severe illness may require postponement. Next vaccine is the meningococcal vaccines. Like pneumococcal vaccine, meningococcal vaccine is recommended for adolescents and high risk groups, travelers and occupational risk. In the adolescents, all individuals aged from 11 to 12 years should receive the Menacwy vaccine with a booster dose at 16 years. High risk group include individuals with certain medical condition like asplenia, complement component deficiencies, those taking complement inhibitors, and people exposed to outbreaks of meningococcal disease. Travelers and occupational risk, those traveling to areas where meningococcal disease is common, or microbiologists routinely exposed to Neisseria meningitis. It is administered intramuscularly, typically in the deltoid muscle of in the adult and older children. Doses and schedule: Menacwy vaccine in adolescent, a single dose at 11 to 12 years with a booster at 16 years. In high risk individual, a 2-dose primary series followed by a booster dose every 5 years if the risk persists. Next is MenB vaccine. It is given in adolescent and young adults, a 2-dose series with second dose given at 6 months after the first. In high risk individuals, MenB vaccine has a 3-dose series that is given at 0, 1 to 2 months and 6 months. Mild side effects of these vaccines like redness, swelling or pain at injection site as well as fever or fatigue may occur. Inform the healthcare provider about any history of severe allergic reaction to vaccine component, and vaccine should be postponed in cases of moderate to severe acute illnesses. It is contraindicated in the severe allergic reaction to previous dose. Minor illnesses are not contraindication to this vaccine. Next vaccine is MMR, Measles, Mumps and Rubella vaccine. It is recommended for children. All children should receive 2 doses to protect against measles, mumps and rubella. In adults, those without evidence of immunity should receive at least 1 dose. Certain adults, such as healthcare workers or international travelers, may need 2 doses. Special cases: infant aged 6 to 11 months traveling internationally should receive 1 dose followed by the routine 2-dose schedule. It is administered subcutaneously, typically in the upper arm or thigh. In children, 2 doses, first dose at 12 to 15 months of age and second dose at 4 to 6 years of age. It can be given earlier if at least 28 days have passed since the first dose. In adults, 1 or 2 doses depending on the risk factor and vaccination history. Inform the healthcare provider if you have an allergic reaction to vaccine components such as gelatin or neomycin. Mild side effects of the vaccine are like fever, rash, swelling at the injection site may occur. It is contraindicated in pregnancy. Vaccination should be delayed until after the pregnancy. In the immunocompromised individual, those with having conditions like HIV or AIDS or undergoing chemotherapy should consult healthcare providers. Severe allergic reaction to a previous dose or vaccine or its component. So this was all about the vaccination from influenza to and hepatitis B to shingles and HPV. There are a variety of vaccines specifically recommended for adult. These vaccines can prevent serious health complication and contribute to health of our immunities. Overall health of our communities. So if whether it's for travel, work, or just peace of mind, it's never too late to get vaccinated. Stay tuned as well as we dive into the key vaccines you need, how they work, and where you can get them. Let's arm ourselves with knowledge and stay protected. Remember to always consult with the healthcare provider to determine which vaccine are appropriate for you based on your health status and risk factors. Vaccines are a powerful tool in preventing disease and maintaining overall health.